I believe is very, very important is with pediatric dentistry, where does it begin and how can we really add a special focus in this specialty? There's something called early childhood caries. This is a serious infectious disease involving kids under the age of 71 months having a single cavity, having a single tooth surface filled, or a tooth missing. We group all these issues into something which we call early childhood caries. It's very important that we understand why kids get such a disease and that we understand that dental caries in children is a medically necessary disease that needs to be treated. And this starts prior to prenatal, prior to the giving birth. We now understand there's something called vertical transmission.
What does that mean? What
that means is because caries is an infectious disease, how it really develops is early on, if the mother or even the father, in case after postnatal, has poor oral hygiene or has cavities, sometimes they transmit these pathological bacteria, disease-causing, cavity-causing bacteria into the kids, causing the kids to have cavities. So when we talk about prevention, we really need to concentrate as well on the mother, prenatal. It's important that they have a very healthy diet. It's important that they maintain and have good oral hygiene. It's important that the mother has routine cleanings, of course. Sometimes we even recommend that they have 3-month cleanings rather than 6 months cleanings.
While they're pregnant and
and everything. So that we can reduce the volume of bad disease-causing bacteria in the mother so that it doesn't get transmitted to the kids.
And if they're planning a family, they should take care. I mean, you never think of, I ought to go to the dentist.
Absolutely. It is so important. The reason why we don't know about this is, you won't believe it, the number one barrier to health care, to dental care,
is scared?
Is scared, but in addition to that is people not aware of such information.
And awareness.
The lack of awareness is what causes the majority of problems. So now that we know that prenatal oral care is important for the child, there's something else that we, not recently, but we've known for a couple of years that hasn't been really promoted, and that is mothers that have poor oral hygiene, periodontal disease, there's a correlation to them having children with low birth weight.
Okay.
And we were never aware of this. This is something that is, poorly promoted. But hopefully now with your audience understanding this, we understand that preventive care starts prenatal. So let's talk a little bit about after giving birth, what we should do. This moves on to the area of prevention. Once again, prevention continues.
Does the child see you just born? I mean, there's no teeth.
Well, it's so important that even when they have no teeth, we keep their oral hygiene relatively clean. The first tooth usually erupts between the age of 6 months to 12 months. And prior to that, we can always take a piece of gauze or some kind of cloth and clean the gums, keeping the child's oral hygiene very, very well kept.
Oh, I have to admit, I never did that with my children.
I'm sure my mom never did it to me. This is something we didn't know back then.
But it stands to reason.
Keeping it clean, reducing the volume of pathological bacteria. Between the age of 6 months and 12 months, it's important that the child makes his or her first visit to the dentist. 6 months to 12 months.
And now, how do they sit on the mother's lap and
They do, yes.
Okay.
Sometimes they sit on the mother's lap. It depends on how cooperative the child is. They'll sit on the mother's lap. Some of them would come in and they'd sit by themselves. And
it makes sense. They get used to the dentist's office.
You couldn't have said it better. We see kids who see the dentist the first time at age 3 months, at 4 months. They are so scared. It's the first time that they've come to a dental visit. They are so scared. They don't have a clue what's going on. Do you remember the first day going to school, or the first day,
First
even
day
the first day coming to
anything.
work?
Yes. Oh, how frightening and terrifying that is.
It's definitely frightening and terrifying. So it's important that we start this early. We start this at age 6 months. The American Academy of Pediatric Dentistry actually recommends that between the age of 6 months and 12 months, we develop something called a dental home for the child. Once again, it encompasses a location where the child can have comprehensive care. The parents could receive information in regards to how to prevent disease, how to maintain good oral health, a place where you can get referrals, a place where you can get treatment. That's what we call a dental home. It's important that this is conducted between the age of 6 months to 12 months.
So when they get their first 6 months or 12 months, you see them.
Yes.
Do you actually do anything?
Absolutely. We would do a very preliminary cleaning. We'll do a preliminary
Even whatever
exam.
teeth?
Yes.
Yeah.
Between the age of, for kids under the age of 2, what we recommend is the parent